Okay, I think we'll get started. It's a little after 12. Want to welcome everybody to the February meeting of the City of Akron Senior Citizen Commission. So I'm going to call us to order, and I'm going to turn to the person who's going to introduce Ted Walco. If that could be me. Was anybody else planning to introduce Ted? Well, if not, I'd be happy to do that. As a board member of Vantage Aging and a past president of that agency, I'm very happy to introduce to you Ted Watko, who is the Chief Executive Officer of Vantage Aging, formerly Mature Services, formerly Senior Worker Action Program. So this is an agency that has had a long history in Akron going back to the 1970s. Ted has been in the role of Chief Executive Officer over a year now, and comes to us from a long time experience with Stark and Wayne County with the mobile meals program there, and with the merging of mobile meals of that area with Vantage a couple of years ago. He brought his expertise to serve a much wider area. Ted, I don't know what would you like to say about your additional background, but it's very happy to welcome you to present about your agency today to the City of Akron Commission.
Hey, great. Thank you so much, Dr. Stearns. I appreciate that warm welcome. I'm very glad to be here. Let me go ahead and attempt to share my screen here. We can get started. Okay, can everybody see that okay? All right, thanks, Sue, for the thumbs up. I don't know what it's about Zoom. It just still makes me a little bit nervous. So, okay, again, thank you so much for the opportunity to talk with the group today. I'm anxious to share more about Vantage Aging and what we're currently doing in our community. Starting things off, we are a 46-year-old nonprofit organization headquartered in Akron, and we provide multiple programs to help older adults age with dignity and independence. Today, I'm going to tell you a little bit about each of our programs and how you and your loved ones or people you know can use them to stay independent in their homes or active in our community. And feel free to ask some questions along the way. Let's go ahead and get started with our mission. Our mission is very simple, promoting a positive perspective on aging. Our vision then is every older adult has the opportunity to live a healthy life and age with independence, purpose, and dignity. And then you can see we've listed there a few of our purposes. Obviously, assisting persons in maintaining productive and self-sufficient lives as they age, and promoting independence, alleviating problems of poverty among people, etc. Let's move on to our programs. We have 4 major programs to help older adults age in place that are available in various counties throughout Ohio. Our programs include Workforce Solutions, Retired and Senior Volunteer Program, also now known as Americorps Seniors, Meals on Wheels, and then our Home Wellness Solutions Group. A little bit about our history. We were formed, as Dr. Stearns mentioned, back in 1975. We quickly moved into some counseling services, and in the 80s started the Retired and Senior Volunteer Program. We also started our nutrition program in the 80s as well. Moved into home delivered meals in the 2000s, and also offered home care and chore services at that time as well. 2017, we rebranded and changed our name to Vantage Aging as we're known today. Dr. Stearns mentioned the merge with Meals on Wheels of Stark and Wayne counties, which actually is a little over 2 years ago already. Hard to believe time has gone by so quickly. And then last year we expanded our RSVP program from 2 counties to 7 counties. We were in Summit and Medina, and we actually picked up the counties of Franklin and Delaware down in the Columbus area, Wayne and Geauga up here in Northeast Ohio, as well as Hamilton County down in the Cincinnati area. Also last year, we consolidated our kitchens of our Meals on Wheels program to our Massillon site. High-level overview, we operate on a $13.2 million budget. We employ 65 full-time and 25 part-time staff. We maintain the 4 programs and a presence in 38 counties throughout Ohio. Let's start with our largest program is Workforce Solutions. Vantage Workforce Solutions Senior Community Service Employment Program aims to help older adults gain the skills and experiences necessary to find the job they want when re-entering the workforce. It's funded by the Department of Labor and the Ohio Department of Aging. The program provides paid hands-on training opportunities to earn industry-recognized certificates to improve their marketability in today's workforce. So on this slide here, it's a very large program. As you can see, $400 million federal workforce investment, and it serves about 67,000 low-income, unemployed older adults per year. To bring that into our perspective here at Vantage, we serve about 725 people on an annual basis. And last year, we were able to place nearly 100 people into unsubsidized employment. So we're pretty proud of that fact as well. As I mentioned, there's some eligibility requirements for this program. The individual must be unemployed and actively looking for a job. They must meet also some income eligibility requirements based on federal guidelines. They must be age 55 years old or older, and they must live in one of the 38 counties that we serve. So how this works is job seekers apply to our Workforce Solutions program, and we actively build relationships with community organizations, other government agencies or nonprofits, and then we place them into an opportunity there in which they're paid minimum wage, working generally about 20 hours per week. And the reason we place them with those organizations is so that they can hopefully partner with somebody in that organization and improve their skill sets. And then, as I mentioned, another thing that we added a couple years ago was industry recognized certificates that align with specific career pathways. Those include a certificate in such things as office administration or customer service, food service, healthcare, or facility management. And again, the goal is to increase their skill set, get them the confidence they need so that they can move over to unsubsidized employment. One thing I do want to mention that we're pretty proud of, harkening back to 2020, the year of the pandemic. Obviously, this is a vulnerable population that we're working with, and obviously organizations closed down in the spring last year, so that had a direct impact on this program. A lot of our sister organizations that also have this program decided to just have the participants stay at home and continue to pay them, like a sick pay. We chose to take a pretty creative and different direction in that we didn't really think that was helping our participants. So what we did was we provided them with training remotely. We would send them workbooks every couple weeks, and they would have things to complete, such things as looking at improving their soft skills or doing a deeper dive into, resume building and interview tips and so forth. So after the first couple weeks of the unpaid or the portion where they really weren't going into the workplace and were just getting paid, we quickly pivoted and implemented that within our program. So I'm very proud of the fact that our team came up with that, and we were able to implement them and keep them engaged in the program. Our project directors then touch base with them every 2 weeks to make sure they kind of did their homework. And then once they do their homework, that leverages us to continue to pay them their wages. Any questions on the Workforce Solutions program at this point? Okay, let me move over to Meals on Wheels of Northeast Ohio. Meals on Wheels is a home delivered meal service primarily for seniors and people with disabilities. And as I mentioned 2 years ago, Meals on Wheels of Stark and Wayne counties merged with Vantage's Meals on Wheels program to create Meals on Wheels of Northeast Ohio. Meals on Wheels aims to meet the nutritional needs of seniors in our community. Food insecurity is a growing issue with our aging population. 1 in 4 older Americans suffers from poor nutrition, and 1 of 6 older adults face the threat of hunger in Ohio. So we want to do something about that. We provide meals to over 800 clients in Summit County and 1,500 additional clients in Stark and Wayne counties. Last year, we delivered over 500,000 meals in the 3-county area, so we're very proud of that as well. We also generally offer congregate dining, but with the pandemic, we were unable to do that over the course of the year, and we were able to transition a lot of those individuals over to home delivered. As soon as the vaccines get out there and things turn, we really want to ensure that we open up those congregate sites because that socialization process is absolutely critical. To address senior isolation, we also have what we call our Wheels for Wags program. Companion pets do wonders for senior isolation, so we want to make sure that those pets are getting fed as well. What we found in the past was actually our clients were leveraging the meals that we provided and sharing them with their pets. Well, that's not good for the client, right? They were not meeting the full requirements of nutrition on a daily basis, and it wasn't good for the pets either. So we have partnered with a lot of organizations, and a sweet spot actually is like the middle schools. They'll do some pet food drives for us, usually around the holidays, and kind of stock us up for the year. But if anybody knows of anybody willing to do some sort of pet food collection, we're always looking for pet food, primarily dog and cat food. So a little bit more on who receives our meals. Certainly seniors, those who can't prepare meals but want to remain in their homes. People with disabilities. Those recently released from the hospital is also a market niche which we have tapped. We actually, a year and a half ago, partnered with Altman Hospital and AltCare Primetime in their Medicare Advantage program to provide 10 meals to individuals in that program who are released from the hospital upon discharge, because they found that nutrition was lacking when hospitals sent people home. And also, so it's a win for the client and also a win for the hospitals, because the hospitals were being, one of the criteria used to evaluate their successfulness was to ensure that the client wasn't being readmitted, or the patient readmitted to the hospital. So this helps them to improve their statistics and ensure that the individuals that, when they're sending them home, truly are on the right path as far as a nutrition standpoint goes. So we started that back in 2020, and we re-upped with AltCare Primetime again here this past January, and we're really excited about that. That's just a new niche for us to continue to help people. And then we also can certainly help people with mobility changes, or I'm sorry, mobility challenges. And we also have a private pay program as well. Okay, any questions on Meals on Wheels? Move over to our Home Wellness Solutions group. Our home wellness solutions services include such things as light housekeeping, doing errands or grocery shopping, laundry, escorting to appointments, and meal preparation. And then we also provide personal care items such as bathing and dressing, daily grooming, toileting, eating assistance, and mobility assistance. And then our final service in this area is our chore services. Those who need to do like a spring clean or assistance with that, we can send a team in there to do some deep cleaning services of cleaning walls and floors and windows and all that good stuff that we all just love to do ourselves in our daily world each spring. Okay. Let's move over to our retired and senior volunteer program. Also, we're transitioning into utilizing the new Americorps Senior logo. It's a federally funded program. And this program here has been a challenge because, again, what we do is we leverage volunteers age 55 and older, which was part of the vulnerable population through the pandemic. And again, sending them out to nonprofit organizations to volunteer and utilize their skills. So with some of our volunteer stations closing down, and this being the vulnerable population, we really were challenged with this aspect last year and had to come up with some creative things that our volunteers could do remotely. So we came up with a pen pal program, which just going back to writing letters back and forth. And it was kind of cool that the seniors could get some letters in the mail. And also we had a segment of providing encouraging greeting cards. People would either buy greeting cards or make the greeting cards, and we partner them up with a senior as well. We also have reopened in our food collection and distribution. We help one of our volunteer stations is the Salvation Army locally, as well as Open M. And we also leverage them within our Meals on Wheels program to deliver our meals. But probably the one that I'm most proud of is our telecare. And that's, again, just pairing up someone to check in with someone once or twice a week for a 15 to 20-minute conversation. And again, with the goal to fight that senior isolation. So between our Rsvp program, we fight it, and also with our meal delivery down in Stark and Wayne counties, it's primarily the meals are delivered by volunteers. We are able to, encourage that interaction between the client and the volunteers in a socially distanced way to make sure that they're doing okay. And if our volunteers would encounter a situation where the client wasn't doing well, they would report that back to our offices and would take the necessary steps to make sure that they were getting the help that they need. So why does our work matter? Just kind of looking here at the numbers in Ohio, people age 60 and up outnumber those under 20. Looking back here at the 2000 census, a lot of these are estimates and projections. I'm anxious to kind of update the slide here once we get our 2020 census information in, but you can see certainly we all know the world that we're living in and that the older population is continuing to grow nationally and throughout our state. I want to kind of wrap up a little bit here on some of our impact numbers. 3,500 seniors received home delivered or congregate meals last year. We had 10,665 hours of personal care services to individuals living in their homes. We had 127 individuals helping in our Rsvp program, helping the community, helping 27 organizations within our area. This, I think, is incredible, the 349,882 hours of career training completed by our CSEP participants that I mentioned first. That I'm just really, really proud of that number, that we're able to keep that large program moving forward and benefiting the individuals in our communities. And then we had about 520 volunteers drove just under 200,000 miles delivering all those meals that I mentioned earlier. So again, just a little bit about Vantage Aging. The pandemic, has been challenging, but we've had to just kind of get creative to ensure that we continue to meet the needs of our aging population and those that we serve. Any questions I can answer?
I have a question for you, Ted.
Yes.
Christine Curry over at Open M.
Hey, Christine, good to see you. We chatted a couple months ago.
Yeah, just a question on your job training for seniors. What job training sources are you using for them? I'm just curious.
As far as the actual training materials?
Yeah, is it online? Is it, just wondering?
No, what we're doing is actually printing off information. Our team was actually creating the specific training materials to start, and then they were able to do some research and find some booklets that we were able to mail out to the participants. So we're cognizant of the digital divide challenge out there and technology challenges with the senior population. So yeah, that's strictly all mailed to them every few weeks.
Okay, thank you.
Absolutely.
And I think Ted also mentioned that programs like this around the country hadn't quite figured out what to do. and that this was unique in the United States to develop this at-home focus so that people could continue to train during this period. Many of you may not realize.
I have a question.
Yeah, I want to also point out that what's unique about Vantage is that Vantage is a national contractor directly for this program, which puts it in a unique situation. Please go ahead. Question.
Questions?
Thank you. This is Representative Galansky. I represent the 35th District, which includes Barberton and parts of Akron. Thank you so much for this presentation. It was excellent.
Thank
So I have oh, you're welcome. I have a number of constituents who are still unemployed due to the pandemic. So is your agency hiring? And if so, can we put that in the chat?
Hiring as far as just at Vantage Aging, to work for Vantage Aging, or in the senior workforce
Yes.
program, or both?
Yes, to work for Vantage Aging.
To work
Thank you.
for
Good
Vantage
question.
Aging, yes. I would encourage people to go out to our website, vantageaging.org, and there's a button at the top called Career Opportunities, and listed there are all of our current opportunities. So absolutely. We're specifically still looking for some help down in our kitchen down in the Maslin area. That's probably our area of greatest need. So if you know of anybody, please forward them that information. That'd be fabulous.
Hey, Ted, this is Susan in Sigmund.
Hi, Sue.
Great presentation. I really appreciate the overview. It's one of those things where I felt like I knew certain pieces to the elephant, but you provided a picture of the entire elephant. So I really appreciate that. And you know, of course, our two agencies have been terrific partners for many, many, many years. And so it's really a pleasure to hear this. One question that I thought of as you were going through your slides, your presentation, can you articulate what is, as calls come into your shop, what's the kind of the number one and two forms of requests? I mean, is it meals? Is it chore? Is it, job? I just wonder, what that looks like on any given day.
Sure. I would say meals by far meals, absolutely. And we're doing some outreach for our Workforce Solutions program as we speak, trying to build that up as well. Probably the area that we need to focus the most on right now, though, is our retired and senior volunteer program. So if any of you know people who are starting to get crazy being at home and are getting the vaccines and willing to get out there and start to volunteer, if you could send them our way, that would be absolutely fabulous.
By the way, just a point of history, the volunteer Rsvp program is one of the oldest funded projects in Akron. It started in 1972 with the YWCA, and the reason I know that it was the first board I ever served on in Akron back in 1972. So there's a long history there of this program, which has been a cornerstone of older adult volunteerism. One of the great things about this is it provides volunteers to major nonprofits. And one of the advantages of RSVP, and I think this is still true, there are some mileage reimbursements, and also there is porter-to-porter while they're serving as a volunteer. Is that still correct, Ted?
Yes. Okay. Wileen, did Wileen have a question? I see a hand up. Or is she good? Okay. Well, thank you, everybody. Again, I appreciate the opportunity to speak with you today. And if you have any questions, feel free to reach out. I will send over to Francis a copy of my presentation and additional information that you can share with your organizations. Thank you.
And I'd like to point out that Ted is one of the newer members of the Commission on Aging of the city, representing agencies contributing to well-being in the city. So thank you for joining us.
Absolutely.
Okay, according to the agenda, are there any major announcements? Well, I can give one, and we'll post this. On February 26th, we are having a special event. It's a distinguished lecture in as part of the sesquicentennial celebration of the University of Akron and the 45th anniversary of the Institute for Lifespan Development and Gerontology. The presentation will be by Dr. Kenneth Ferraro, who is distinguished professor of sociology and gerontology at Purdue University. And he will be talking about frontiers in the science of aging. Dr. Ferraro, by the way, is an alumnus of the University of Akron, but since his graduation in the early 80s has become one of the foremost sociologists of aging in the United States. He is the co-editor of the Handbook of Social Sciences and Aging, among many other accolades. And that's going to be from 1 to 3 on Friday. We'll put up the posting so that you can have the WebEx connector. But we just formally started to announce that today. So if you'd like to have an opportunity to hear some of the latest approaches to the field of aging, here's your opportunity. Anything else? Any other announcements? Okay, let's turn to the review of minutes from the December meeting.
Harvey, I'm sorry. This is Susan. Can I squeak one more little announcement in here?
Susan, please go right ahead.
Thank you, Dr. Stearns. I just wanted to quickly remind people that if you or your constituents or your friends or families or anyone continues to have questions about the vaccine, to please know that you can call Direction Home for the most up-to-date information. And that 800 number is 800-421-7277. And I will say that while we can't help with appointment making, we can at least give you the information as far as who is, taking appointments for vaccines. And you'll notice that I shared a phone number and not a website. And that is very purposeful as we are understanding that at the very least, we need to be able to provide phone numbers for our older adults rather than simply relying on the internet. Certainly now more than ever, we have come to understand that the digital divide. And so it's more important now more than ever that we continue to provide phone numbers for our work. That isn't perfect either, but that is, that is at least one option that we need to remember. So again, Direction Home is 1-800-421-7277. Thanks, Harvey.
Well, it's very apropos. I can tell you that my wife and I are still on the search. We're on a number of lists, but we have not yet been able to get an appointment. And so I can tell you that I know for many of us, it's an exercise in continuing frustration. And yet we know that if you hang in there, you eventually will make it. But the persistence factor is really critical here. You just have to keep at it. I have friends that have traveled to Mansfield, have traveled to Youngstown. How they find the open slots, I'll never know, but they do. This still is a major issue for a lot of people. As you know, we were last week in the 70s. Many sites still haven't finished their 80s, from what I've learned. So they're still, and then of course, very importantly, the decision was made to protect all of our teachers. And so that is also taking precedent over other things. I think that's probably a very reasonable thing to do, but nonetheless, I know for many people, this is still a challenge, whether you have a computer or a phone or all of the above. So I don't know what other people's experience have been, but this is my personal experience. I fit into the 70 to 80 category. I know others have had greater success, but it's just, I just want to point out it's something shared by lots of people as a challenge. Okay. Okay, let's move on
I
to
have a,
we still have to approve the minutes. Excuse me, I apologize for the phone ringing. Let's review the minutes. And are there any additions or corrections? If not, can I have a motion for approval?
I'll motion to approve. It's Karen.
Okay, is there a second?
I will second.
Okay, thanks, Ted. Okay, any further discussion? If not, all in favor of adopting the minutes as presented, please say aye.
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 Question members? Okay, any nays? Okay, thank you. These minutes are adopted. So let's now turn to old business, age-friendly Akron update. Susan, do you want to start?
Sure, I can give a quick update. Many of you know that Age Friendly Akron was kicked off over a year ago. And that first year we spent looking at our doing a needs assessment. We've completed that, presented the findings, and now the Age Friendly Akron group is beginning to have discussions about what are those priorities that we as a community want to tackle. I would encourage you, anyone that's on the call, to please if you have something that you want us to really understand and to know and to take forward as a priority, please know that you can contact the Mayor's Commission. And we're happy to take that information. As I said, we are evaluating the formal needs assessment and seeing what is coming from the data that we garnered. I think that's it, Dr. Stearns.
Well, and I can tell you that, as you know, the survey, which was done, it was in progress a year ago, of course, was completed just before COVID-19 affected our community. So one of the things that we've been doing since then, one of our tasks was to do focus groups within each of the wards of the city. Thanks to Francis Ladd working with me, we have done a number of focus groups, and we have another one planned for this week. And so I can tell you that we are collecting additional data now, especially focusing on COVID issues that may have emerged during this period. And that will be ongoing as well. And that will help us have additional information to help set priorities. As you know, the age-friendly cities approach focuses on 8 domains. And one of the first things that we will have to decide on is how many of those domains we will zero in on as a priority, if not all of them, but that's the next step in the process. And while we're here, Susan, you might just give us a little thumbnail on age-friendly Summit County.
Yes, and so as I said, this process is you do your needs assessment, identify your priorities, and then really roll your sleeves up and get to work on those priorities. We're following that same process or that same sequence for Age Friendly Summit, and just completing age-friendly summit needs assessment. And we will begin our work identifying those priorities, I would say probably in the spring, a little later in the spring. So following closely the process with Age-Friendly Akron, but certainly recognizing that both initiatives are unique to themselves. Although I'm sure that there will be overlap and some synergies that we'll be able to pull together. So this is an interesting time as we look at becoming livable communities for everyone, every segment of our community.
Yeah, another thing we might mention, and it's been pointed out to us that we need to pay attention to some of the special cultural groups within the city of Akron, where there may be a need for language and translation so that we can better understand the needs of those specific populations. So that's something that we're trying to figure out how we can develop the right approach so we can get that additional information. So I think that's something I want to mention as well. And we have asked each council person to help us locate it. So if you are someone living anywhere in Akron, you'd like to volunteer for a focus group, if you would just let us know, you can send your interest to our secretary, Francis Ladd, and then you could indicate, if you would, what ward you're in. We will be happy to invite you to participate. One of the incentives for participating in the focus groups is a $25 check for participation per household. Okay, let's turn now to community updates. What's going on in our community during the pandemic?
Harvey,
Yes, go right ahead.
this is Mei Chan. I wanted to first ask you, what is the format you use to do the focus group right now?
Well, we have a discussion guide that was approved by the IRB, the Institute Review Board of the university. So it includes many of the same types of areas that were included in the survey that we did. And I think I thought that we had shared that with you already. If not, I think Francis will be happy to send that to you.
Are you doing it on Zoom when you have these focus groups?
No, the focus groups we're doing by conference call. Again, going back to something that Susan raised about the digital divide. Since we know that there's a high rate of people with computers and Wi-Fi in the city of Akron, but we also know there's a large number of people who do not have computers. So our approach to make sure that we don't just represent people with computers is to use a conference call approach. So everything is being done on a Zoom phone line so that we can record those sessions. So it's all by telephone. So no one needs to have a computer to be a participant.
I have another question for Susan Sigmund. This needs assessment for Summit County, has it been completed already?
No, it has not been completed. They are doing a review of literature right now, and I know the Center for Community Solutions will be reaching out for specific focus groups as well.
Okay, thank you.
Here's an interesting fact. Obviously, the largest community in Summit County is Akron. And so, but I think I was informed at our last meeting that there are 22 specific communities that are in Summit County. So one of the things that has to be taken into account in the county assessment is all of these unique aspects of these various communities. Am I right about that, Susan?
Yes, yes, you're spot on, Dr. Stearns. That's correct.
Am I right with the 22 communities?
Yeah, yes.
So if you can think about, each one of these, well, it's not the business of our Commission on Aging to discuss this in particular, but we're having enough trouble with one city doing this. So you can imagine the challenge that comes from being sensitive to all these multiple communities as part of the process. Said more than I need to say. Remember, I'm isolated and I'm only teaching one class, and so there's pent-up professorial tendencies here that have to be suppressed. Okay. Any other community updates?
Dr. Stearns, it's Karen. Would it be helpful if I watch the hands up and call on them for you?
It would be very handy because I'm not seeing hands up.
Sure. So Senator Galansky, I'm not sure, or Representative Galansky, I'm not sure if she's still on the phone yet, but she had an announcement. Are you still there? If she's not, there's information in the chat. She was saying the week of February 22nd, there's a 5 days of information that's coming out about human trafficking in the state. And Brenna, you had your hands up.
Okay,
Brenda, go
I
right
think I'm
ahead.
unmuted. So, and I'll put my hand down. How's that? Lower hand. Okay. So we have been trying to keep up and work with Summit County Health Department and Access Point for AMHA to try to help connect residents with vaccines. And I did sign up. This is on the first one. I signed up to receive those notices, and at 12:13, just by chance, the notice came up. They're having the weekly clinics that are at Summit County Health Department. And the notices, when you get it, they tell you that you can go, right now they're doing 65 and older, and you can go on the website or make the phone call beginning at noon tomorrow. So the caveat is that this morning they said that they have, I think, I'm not representing Summit County Public Health if someone else is on here, but they said that they had 600 vaccines. That's for everyone for this week for the clinics. So you really have to, it's an exercise in diligence. As soon as that opens up at noon, the calling or getting online to get your appointment in, and there is information you have to fill out. So they've been having weekly calls with to try to help with community members and agencies to try to help. And I see some that were on that call today to try to get minority populations the information about, when vaccines are coming or how to get signed up. And I think the biggest thing they just said is right now, because they added, with the governor's orders, they've added those age groups so fast, it's been really difficult to get the numbers because there's for specific age groups or specific, the teachers or whatever the categories are. So there's more coming and there's more information, but it does feel kind of like an exercise in just making phone calls and all that, but there will be more that will be coming out. And they did say that Summit County is using their vaccines appropriately and efficiently. So I think that's a good thing for us with Summit County. And then we were contacted about some other vaccine clinics, and I don't have any more information yet. But obviously I'll make sure I let the group know as we know more. And I think their focus right now is on City of Akron. So I could probably leave more questions and answers at this point, but at least we're moving ahead.
Thank you, Brenna. I think that's really important information. So appreciate that.
Susan, you have, do you have master rates? Because Wileen has had her hand up, but she's muted. I don't know if she can get the mute off. Can you unmute her? Well, while we wait for that, I believe it's Mary Helen Horgan. You have your hand up.
Hi, this is Mary Helen Horgan. Thanks, Karen. Nice to see you again 30 years later. I just wanted, I'm from Access Point, and I just wanted to let everyone know, thank you for having me here today, but I wanted to just tag on to Brenna's, is that we've been working.
Oh, she just muted herself.
I can't unmute my, oh, did I get unmuted now?
Yeah, you're
Yes.
good now.
Oh, Lord, sorry. Hey, I'm Mary Helen and I'm from Access Point. I just wanted to tag on to Brenna's real quick about us targeting around our zip codes 44306, and we've been pulling a lot of patients in the obviously in the appropriate age that Summit County Public Health has given us for the COVID. We're only getting 100 vaccines, but we're able to give 102 each time. So we're pulling from all the neighborhoods, and we're actually have two community healthcare workers that are working in the 44310 zip code, Nepali community healthcare workers, to be able to outreach them. So if there's anything that we can do, or any patients that you feel are in high need, please give me a call and we'll do whatever we can to be able to accommodate. And another shameless plug is that we've opened our food pantry in Arlington and in Barberton locations. So we're really excited about that, and let us know and we'll be willing to help in any way we can. Thank you for having me.
So thank you for sharing. We appreciate it. Anyone else?
Mary Helen mentioned 30 years because she and I went to high school together. So it's been a little while. There's no more hands raised, Dr. Stearns, but I know John Valley is on, and it's good to see you, John. It's been a while. And
Thank you.
I'll
And
let
John, I
you
guess
update.
you're on the agenda for City of Akron.
Well, first of all, I want to thank all the members for your service. I know you've been doing this for a few years. I know I haven't been too much involved in it the last couple of years, but Francis and I had been talking online last month or so, and some questions came up about 311. And she has asked me to kind of talk maybe for a minute or two, a couple minutes about 311, and then go ahead and take any questions that anybody has. So if that's okay, I'll go ahead.
Please do.
Okay. The 311 call center opened in 2004. We currently have 6 call takers. We have 1 coordinator and 1 supervisor for a total of 8. You can call 311 from any cell phone, or you can call 330-375-2311 from any land phone, or you can get on our city's website and provide a complaint or a service request from akronohio.gov/311. But the primary focus of the call center is to improve the quality of life for Akron residents. The call center agents answer questions and address non-emergency complaints about a wide range of city issues. We average between 130,000 and 150,000 phone calls a year. The call center is open Friday morning at Monday through Friday from 7 a.m. to 6 p.m. And we're closed most holidays unless we're into a emergency situation. But, you know, when I go to block watch meetings and ward meetings and things like that, which we haven't done much of in the last year because of COVID, but I always ask the question to the group, what do you think our top service request in the 311 is? Do you think it's potholes? Do you think it's I need my street plowed because we just had a snowstorm? Or is it high grass and weeds? And I always ask that question, and people raise their hands and they answer it. So I'm asking the group here, does anybody want to take a guess what our top service request is?
High grass and weeds is my guess.
Okay.
Leaf
Anybody
removal.
else?
Leaf removal.
Leaf removal? Yeah, during the
Potholes.
week program it is. Potholes? Okay. Well, I hate to tell you, everybody's wrong. Believe it or not, the top 3 service requests are all trash related. When I talk about trash related, I'm talking about you call 311 and you order a special pickup, bulk pickup through our sanitation program, or a cart request, or they missed my trash today. And 43,000 plus calls are those three related: trash carts, special pickups, and things like that. The high grass and weeds, yeah, that's busy, very busy from mid-May all the way through late August. And potholes right now, obviously, because we're in the winter with the snow and ice and the thaw and the freeze and all that. And then let's see, what was the other one? Plowed my street. We've had a pretty mild weather winter here, so that hasn't been too bad. But out of those 130 to 150,000 phone calls that we get, we generate 70,000 plus service requests. And when I say a service request, that's just what I'm talking about. You got a pothole, you call 311. We got a pothole on such and such street. That's entered into the system, and that's a service request. So we have about 70,000 and some change of those a year. And our 311 online is growing. It's getting bigger and bigger. And we had 8,400 online requests for services in 2020. So we're pushing about 79,000 service requests a year. Another thing that we started to do in 2020 is we start answering all the water and sewer dispatch phone calls from the 7 in the morning to the 6 p.m. when our call takers are on duty, and we were able to reassign some water and sewer personnel to other areas where they weren't bogged down answering the telephone. So we received 1,100 sewer calls and a little over 3,000 water calls in 2020. But to give you some other examples, and I promise I won't talk too much longer, and I'll start answering any questions that you might have. We had 4,700 high grass and weed complaints during 2020 into 311. We had 1,174 junk vehicles in 2020. These are all 2020 figures. We had 2,839 exterior trash complaints. That's just people not taking care of the yards and, furniture and wood and tree debris and things like that. And here's a pretty amazing one. We disposed of 3,637 tires just on 311 calls in 2020. I think with that, I think you guys got the idea of what the 311 call center does. A lot of times it's just giving out information. I mean, when Lock 3's open and our summer programming and our concerts and the park series are going on, we get an enormous amount of calls from residents just for informational. When's the fireworks this year, or when's the festival downtown, or what concert is in the park this coming Wednesday night. So a lot of them are informational services, but there are a couple things that I think help our aging population. Is we have what's called a medical waiver. If you contact our 311 call center, they will mail you an application paperwork if you don't have anybody at your household that's capable of bringing that trash container out to the curb. You fill out that paperwork, you have it signed by your doctor or physician, and we'll have somebody come out there and meet with you, and we'll say, okay, your trash day's on Tuesday. We're going to pick up that trash cart right here on Tuesday, and we're going to dump it, and we're going to retrieve that trash container back to you. We got a couple thousand that we have on our medical waiver program. And we also use it for plowing our driveway approaches when we're into a 5 inches or more, and we're into a residential neighborhood plowing, where we plow the driveways back in, and they may have to get out to go to the doctor's office or the grocery store or whatever. We do have a program with that medical waiver that we'll go out there and we'll plow out that driveway approach for you. And all these are available on 311. So with that, I'll answer any questions.
Mr. Valley, we had a discussion. The commission has weekly conversations. And one of the things about what you just talked about, the picking up the trash, that for some people, they can handle it during the summer months, but they need help during winter. I don't know if there's been any contemplation of that issue, where people don't have to have it, long, but basically during the winter months.
We can accommodate both. I mean, we do have some that don't want to go out in cold, and maybe from November to April, we'll go ahead and we'll retrieve that container for them and dump it and bring it back. And then from the nicer weather, in some cases they do it themselves. So we do have, I don't know how many, but we do have some of those situations, and we will work with the president on that.
Yeah, I know from a recent focus group that we did last week that this is a major issue for some people. And so I think a lot of people are not fully aware that this is an option. So.
Talk about the groundhogs, please.
Oh, Francis, we had a major issue with a person who has had severe groundhog issues. And so the issue of how to get rid of pesky animals and how the city, what's the city willing to do and not do? Will they pick up trapped animals, or will they facilitate helping people deal with squirrels, raccoons, groundhogs? Some of us seem to have yards that just attract these little creatures who can be problematic.
Well, nowadays we have more raccoons, more groundhogs, and more possums than we've ever have seen in quite some time. But those three animals that I just mentioned are the responsibility of the Ohio Department of Wildlife. We won't go out there, we won't trap them for you, but what we will do for you is we will have you come out to our 850 Market Street. You can rent a cage. All you're doing is putting a security deposit on that cage. And once you return it, we will give you that security deposit back. But then you're responsible to dispose of that animal at the Summit County Animal Shelter. Now, right now, the Summit County Animal Shelter will only take dogs from us, but they will take trapped animals from the general public, residents of anybody in Summit County. But they charge you a fee to dispose of that animal too. So, but we get a lot of groundhogs, we get a lot of raccoons, we get a lot of those types of complaints. I mean, generally when we talk about animal control and animal complaints, they're mainly barking dogs running at large, this dog, I didn't see a license on him, those types of things. Those are generally the animal complaints that we do get.
Just to kind of align with that is that sometimes those animals show up because of vacant lots next door that have tall grass and weeds. They like to hang out in there. Last year, you guys did the Mow to Own program. I just wondered how successful that was and if it freed up some resources so that you guys can mow a little more frequently on those that are still remaining.
I thought it was a pretty good program for our first year. We identified 1,169 lots that we mow, the Department of Neighborhood Assistance mows. And when I talk about these are vacant City of Akron owned lots. So we did reduce that number by about 100, where we had individuals participate in the Mow to Own program, where they mowed it for the mowing season of 2020. And our OID department's working with transferring the deed and the title and all that to the property owner. So we figure they're going to maintain their property. Now they're going to maintain this vacant lot for us, and it's going to look continuous of what their property presents. So we think it's a good program, and we're going to do it again in 2021.
It's interesting that you talk about all of these lots of the city of Akron. One of the initiatives under age-friendly cities is the creation of affordable housing. We have so far pursued some of the national seminars, but and I know recent discussions, regarding developing new construction. But I'm wondering if the city might ponder, from an age-friendly city's perspective, the issue of creating affordable housing, working with other entities. That clearly is something that emerges as a priority in every other city.
Yeah, that's definitely a priority of Mayor Horgan. He's constantly trying to increase our population in the city of Akron. And we have what's been pretty successful so far, our 15-year tax abatement program. And anybody wanting to purchase a vacant city property and build a new residential property, and plus our Office of Integrated Development, they are doing some of these things and working with nonprofits like Habitat for Humanity and others on developing new housing opportunities. And you get a 15-year tax abatement where you're just paying the property taxes of that value on the property prior to construction.
So I know as part of our age-friendly Akron initiative that we will have a committee on housing. So we'll maybe be able to pursue some of that as part of that planning process.
I think that makes sense, and you would want to reach out to Jason Segedy. He's our planning director. He's in the Office of Integrated Development, and he and his staff would be a great resource for you.
Other questions or comments? We have 37 people on the call, so we have an opportunity for any of you to ask a question or bring up a topic. Thank you very much, Mr. Valley.
Okay, any other questions for me? I know Karen sent me a text, but no, I'm still here, Karen.
Well, now, Mr. Valley's a wonderful resource. So further questions or comments, you can contact him directly as well.
Yeah, John, we just had a question come up in the chat. Could
Okay.
you give people the name and contact for the housing development?
That would be Jason Segedy, Segedy. And Jason is our planning director. He works for the Office of Integrated Development. And first of all, his email is jsegedy@akronohio.gov. And his phone number is 330-375-2198.
Great, thank you.
You're welcome.
Other comments? Commission members, are there any issues that you would like to bring up at one time?
Lori Herring put a note in the chat box that says, do we have any kinds of flyers for the focus groups? She has 3 senior buildings that she manages and would be willing to put the posters up there.
Okay, could she send to our secretary how to reach her, to Francis? That would be helpful. And we appreciate that offer.
Francis, do you want to put your contact information in the chat so that Lori has it? All right.
Okay, anything else?
Harvey, I have a question. I don't know if it was Brenna or not who gave the information that the Summit County Health Department is letting people sign up tomorrow. Would that be for people who have already registered, or anybody can just go online and sign up?
Okay, now I'm unmuted, sorry. So you need to register on the Summit County website, and then they're sending the emails out. So that's how you're registering to say you're interested in getting information, and then they send them out. And they did say this morning that they have like 10,000 people that have registered. So yes, 10,000 people that have registered. So, you know, it all depends on when you register, you put in your age group and everything. So you'll get the notices.
Okay, so you really cannot just go onto the website. You have to wait to get an email from the health department.
Yeah, I'm not sure. Let me see what it says, because I just got the notice because I had registered. So if you haven't registered, I'd get on it quick, because they're doing these every week. And to register for an appointment, you call 330-812-3795.
Can I just jump in there, Brenna?
Yes.
This is Christine Curry over at Open.
Yes.
And just to answer Mary's question, you've got to go in and register to get the email with the phone number and the link information.
Correct.
Before you can move forward. So you've got to be already registered in that block of 10,000. So you've got to go to the Summit County Public Health website and register for the first dose. And then once you receive that email, then you'll do the second piece. I know.
Right. Go ahead.
I know some people, a lot of my friends have been having trouble, and even with the segment of the population we work with here at Open, I've been trying to I registered my parents a few weeks ago, and we just received notification that they're able to call in, and they fall into the same category as Dr. Stearns. Hi, Harvey.
Hi, Christine.
70 to, you know, even a better bottle of wine than we could imagine, right, Dr. Stearns? But you've got to follow the prompts and follow those instructions. You can't just call in. You've got to be in the queue and registered up, just so you understand.
That's correct. You're absolutely right, Christine, because the reality is tomorrow, the people that got the notice, when you call in, you will call in or go online. Last week it filled in 4 minutes. So, you know, the more vaccines they have, and, you know, this process continues. But I think the reality is, because I had the same thing, it was kind of group emails, group texts going around for all of my friends and their parents and grandparents going through about getting signed up. And last week we were at the same feeling like, oh my gosh, no one's going to get contacted. I had friends get signed up through Drug Mart, through Marks. I think that was, and then one through Summit County Public Health. So, you know, it feels very daunting, but the processes will keep working out. And I think because they've had so many age groups getting those notices, it seems very overwhelming. But I think that process will just keep improving as they have the system down. It's really what they stressed today was just to make sure that people did not get the idea that I'm just going to go at the end, and then if they have vaccine left over, I can get in, because that will not happen. You have to have an appointment to get the vaccine on Thursday when they have the clinic. So thank you. Thanks for Christine for saying that.
And just as an encouragement, there's no limit in how many places you register. I know I had my in-laws at 8 different places.
I'm not even
and they're in the
actually
80.
have a whole pile of questions, but I'm fine letting the open demo take its course, and then I'll know what to ask for sure.
But I had my in-laws at 8 different places, and they're in the 80+ age group. And they did get it last week. So the more places you can be on the list, the better. And I believe that a lot of places that have lists are still working through the 80+ age group. So I think that's a good thing. I mean, but there are still 80+ that are being serviced before they move to the 70 to 80 age group, which is just an encouragement to everyone.
So just think, here are all of us who are very much able to be using computers and respond to these cues and demands. But what about all those people who don't have any idea how to reach out? Some of the older adults in greatest need in Akron who really are maybe just getting by, taking care of the basics of daily living. They have no idea how to connect. So these most vulnerable people should be our concern as well.
And I think that's why the Ohio Department of Health has a really nice commercial out there pointing that out and encouraging people to look for older adults that are near them and help them. And there was a really nice story about someone, it was in a different state, but that's basically what she was doing. She was just registering older adults in her community, and she was able to help people get that. But yes, absolutely. If we know of older adults that are in those populations, we should be, and that's where my in-laws were. I had to help them.
Yeah, Wileen, would you like to say something?
I'm having trouble maneuvering this phone.
Oh, we can hear you.
Okay.
Okay, well, so you don't have a question? Okay. Well, let me just say, any other
Mr.
issues?
Fortnoff, do you have a question?
Well, I just wanted to add that as far as this vaccine, I know there's so much stuff going around about it and it's so difficult, but I do know that a lot of the pharmacies, I don't think the Summit County Health does, but in pharmacies, they will have a list of people they can call at the end of the evening. So if people don't show up during the day, those vaccines are wasted. So they'll call 2 or 3 people, whatever they need to do to get someone to come in and take those vaccines. So if you use a regular pharmacy, I would suggest that you go see your pharmacist and ask them about that. If not, I would suggest you do pharmacies that you can get to within 5 or 10 minutes in an evening at 7:30, 8 o'clock when they're closing down and they need to give those vaccines out. I'm on the list of three pharmacies now. So because it's 65 and older this week, so I got in on that list. So I went to 2 of them are within walking distance of me. So I'll be there in a flash. So both my wife and I are on the list of those. So if you know of anyone, I don't think we need. It's hard to say don't spread that around, but there are people that need that help, and if you can get them on that. We know that a lot of seniors visit their pharmacies on a regular basis because they can't afford to buy all their prescriptions at one time. They spread it out through the, so so I would tell them to ask their pharmacist. My pharmacist was like, "Oh yeah, Alan, no problem," because we're there, often, my wife and I. So that would just be a suggestion to everyone. It's a serious problem, but I think that everyone should stay calm, that we have enough to be stressed out about at this time, that we need to stay calm about this. We'll all get it. It's just going to take a little longer than the politicians tell us it will.
No, well, thank you very much, Mr. Fortnoff. That's good advice. Patience, up to a point, is a good thing. Advocacy is another good thing. So we balance there somewhere. Other comments? If not, I want to call attention to the fact that our next meeting will be on March 8th at noon. And the presentation at that time will be Asian Services in Action, or Asia Services in Action. So we look forward to hearing the great work of that agency. I want to thank Ted Watko again for his presentation today. I'm assuming that we want to do a wrap up if there is no further questions. So I will ask if a member of the commission would make a motion for adjournment.
Susan says so moved.
Okay,
I
is it-
second.
Okay, Retta seconds. Okay, non-debatable motion, all in favor say aye.
Aye.
Aye, commission members voting only, please. Okay, any against? Okay, thank you all very much. We appreciate, I think we had 33 people today on right now. I think we went as high as 37. We think that this mechanism of using Zoom is actually providing us a much better outreach. And so we look forward to us getting together again. So thanks, everyone. Be
Thank
safe.
you.